right, you guys have to see this.
Of young people, sudden cardiac arrest is many times fatal and often preventable. Chris O'Connell introduces us to a Mercer County mom and doctors at CHOP with a life-saving message.
It can happen to anybody, anytime, anywhere.
This was 5-year-old Anthony Patricelli this time last year in a bed at Children's Hospital of Philadelphia, recovering from the unthinkable, sudden cardiac arrest. His heart stopped while watching his sister's soccer game last May. Anthony is a lucky kid. Not only is his mom a nurse who performed CPR, police arrived on scene that day within 2 minutes with an automatic external heart defibrillator that shocked Anthony's heart back to life.
He was 5 years old. Who would have thought that my son would have collapsed, in cardiac arrest? In hindsight, I'm glad it was in front of me.
But Anthony is not alone. Research done here at CHOP estimates more than 23,000 kids every year suffer from sudden cardiac arrest.
These events happen in fields, during basketball games, and they can be sudden, devastating events that can lead to children dying.
Dr. Miriam Name is a cardiologist at CHOP and a member of the Youth Heart Watch, CHOP's program aiming to prevent sudden cardiac arrest in kids and adolescents. So far, it's helped 250 Philadelphia area schools to become heart smart and advocating for AEDs in every school.
Every single one of us should learn how to perform CPR and how to use an AED. It is very, very simple.
Some of the warning signs of sudden cardiac arrest, family history, shortness of breath, or unexplained fainting. Anthony's mom says if it wasn't for an AED and knowing how to use it, he probably wouldn't be here right now. She's hoping to put one on every athletic field in Mercer County.
Coaches, the layperson, it's just a good idea to know where it is. If something should happen, be prepared, be familiar, and be comfortable around it, because you never know.
In University City, Chris O'Connell, Fox 29.
Cannot stress enough the importance of AED, right? So whether it's the workplace, whether it's the school, youth organizations, church, synagogue, whatever it is, we always advocate at least take a look into some grant programs that might be available. Take a look at CPR training, whether it's just a hands-only CPR course or if it's a full certification course. Highly recommend and advise that everybody is doing this, because this is something that we're seeing in the national media. I mean, it's pretty much everywhere you look these days. These situations happen, and it does not discriminate. There is no age restrictions, anything. This can happen to anyone, anywhere, which is why, training and then having the resources available to provide advanced care like they talked about in the video with the AED machines, the external defibrillators, to get a shock to that person so we can help restore a normal cardiac rhythm. Remember, AED machines, you can't accidentally shock somebody. You can't injure someone by using it. They're safe to use. They're effective to use. You put the electrodes or the pads on the person as it shows in the pictures. They audibly prompt you through step-by-step of its use and process. They're really easy to use, good to have available at any venue, really, to help restore that normal cardiac rhythm. Remember, when it comes to sudden cardiac arrest, the AED machine is only going to advise a shock under 2 rhythms. There's 2 rhythms of the heart's electrical system that are actually shockable. So that's a ventricular fibrillation, or maybe it's a pulseless ventricular tachycardia. So if it's not detecting that rhythm, it is not going to advise shock. It's just going to tell you to continue CPR. So again, they're safe to use, they're effective to use. We highly, highly promote everybody take a look at some features that they have with AED machines and how to use them, and get trained today. Help save a life. Thank you guys for popping back to the channel.